If you're taking Ozempic, Wegovy, Zepbound, or any other GLP-1 medication, there's one mistake that almost nobody talks about, and as an obesity medicine physician, I see and hear about this all the time, and it's quite frightening. Hi, I'm Dr. Esra Shermadou, and I hear and often see people celebrating the number on the scale without paying attention to what they're actually losing. And honestly, I understand why. When you spent years struggling with your weight, trying different diets, starting over every Monday, feeling frustrating that nothing seems to work, seeing that number on the scale finally move can feel incredible. It can feel like relief. It can feel like hope. And I never want to take away from that. Weight loss in any sense can absolutely improve health and quality of life. But while we're celebrating the number on the scale, we may not be paying enough attention to what we're actually losing. And sometimes we're losing something we desperately need to keep: muscle. Now, most people think weight loss is just weight loss, but that's not how it actually works. Your body weight is made up of a lot of different things: fat, muscle, water, bone, and other tissues. So when the scale goes down, we have to ask a more important question. What exactly are we losing? Because the goal isn't simply to weigh less. The goal is to improve our health. And that's where I think a lot of the conversations around GLP-1 medications fall short. One of the questions I often ask patients is, why do you want to lose weight? And while people often start off with physical reasons, like, I want to be able to fit into my old pants, I want to wear a bathing suit when I go on vacation, I want to look good in pictures, when we dig down deeper, there's so much more to that. I often find that people want the old confidence that they once had. People want more energy. They want to improve their health so that they don't end up with the complications of diabetes or high blood pressure that they saw that their parents go through. They want to be able to travel comfortably. They want to be able to sit in an airplane seat. They want to play with their kids or grandchildren. They want to feel better in their bodies. They want to be able to stay active and independent as they get older. In other words, they want better health. And if that's the goal, then preserving muscle has to be part of the conversation, because muscle is one of the most overlooked organs of metabolic health. Muscle helps regulate blood sugar. It improves our insulin sensitivity. It supports metabolic function and helps maintain strength and mobility as we age. And as we get older, muscle becomes increasingly more important for maintaining independence and quality of life. We spend so much time talking about losing weight that we forget to ask whether we're keeping the tissue that keeps us healthy long term. This is one of the reasons my approach to medical weight loss is different. In my practice, we don't just focus on the number on the scale. We look at body composition. We talk about protein intake. We talk about strength training, because my goal isn't simply to help you lose weight. My goal is to help you lose fat while preserving the muscle that you need for long-term health. And one of the challenges with GLP-1 medications is that appetite decreases. That's one of the reasons why they work so well. People eat less, they're less hungry, food noise decreases, but then there's a potential downside. Most people aren't eating enough protein before they even start a GLP-1 medication. And so I see this all the time. People will come into my office and they're eating far less protein than their body needs. Then they start a GLP-1 medication and their appetite drops, their food intake drops, and their protein intake drops even further. And as we get older, maintaining muscle actually becomes more challenging. Our bodies become less responsive to the signals that stimulate muscle growth and maintenance, which means that preserving muscle becomes even more important. And that's why I don't simply hand someone a protein goal and send them on their way. We work together to gradually increase protein in a way that fits their lifestyle, fits their preferences and their tolerance. Because if someone is eating 40 grams of protein per day and I suddenly tell them that they need to eat more than double that, they're probably not going to be successful. And we have to be able to make sustainable changes. Another thing we focus on is strength training. And I think this is where people sometimes get intimidated. When I say strength training, I don't mean you need to become a powerlifter, although there's nothing wrong with that. I don't mean that you need to spend hours in the gym. I don't mean you need to train 6 days per week, but you do need to challenge your muscles consistently. Even 2 focused strength training sessions per week can make a meaningful difference. The goal is to give your body a reason to hold onto that muscle while you're losing weight. And finally, we want to avoid crash dieting. I know it can be tempting, especially when the scale is finally moving. But generally speaking, the faster we lose weight, the greater the risk of losing muscle along the way. Slow and steady may not be exciting, but it's often better for preserving lean mass and improving long-term outcomes. One thing that generally concerns me as an obesity medicine physician is when someone loses 30, 40, or 50 pounds and nobody ever asks what percentage of that came from muscle. Because weight loss alone doesn't tell us the whole story. Body composition matters. Strength training matters. Metabolic health matters. The number on the scale is only one piece of the picture. So if you're taking a GLP-1 medication, I want you to remember this. The goal isn't simply to weigh less. The goal is to be healthier, to reduce disease risk, to stay active, to remain independent, to move well, to live well, and to continue doing the things that matter most to you for as long as possible. And if that's our goal, then we have to care about preserving muscle while we lose fat. Because muscle isn't just about strength. It's one of the foundations of long-term health. So if you're on a GLP-1 medication or know someone who is, please share this with them. You may just be saving their life. And if you're on a GLP-1 medication, let me know what your journey has been like. I'd love to hear about it. And if you're not on one but considering, what's holding you back from speaking to your doctor about it? All right, that's it for now, and I'll see you guys next week.